Hello, everybody. Welcome to SignHealth's webinar this morning. Thank you very much for joining. My name is Deepa, and I will be your host this morning. We're joined by our four panelists who will introduce themselves later. I will just start by explaining the aim of this webinar this morning. SignHealth are using this morning to explain about the work they have been doing up until now and plans for the future. So we'll have an hour with you this morning. If you have any questions or any comments, please feel free to ask questions and comment, and we will try throughout the session to answer all of your questions and comments. If we don't have time to cover these, we will try and provide the answers later. Please don't make any comments or questions about specific individuals. We would like to respect the privacy of everybody. This is a live event, so there might be some glitches with the interpretation, translation, and captioning, or the sign language used, or some technical issues, but that is normal. So I would just like to say I am based in England. I'm actually in my children's bedroom at the moment for this live stream. So I would just like to invite the panel to introduce themselves, explain their role, where they are in the world, and what room they're in. So I would like to hand over to you, James. James speaking. Thank you very much, Deepa. Hi, everyone. I'm James. I am Chief Executive here at SignHealth, and I am at home in Walthamstow in North East London. Thank you. Over to you, Christine. Christine speaking. Hello, everybody. My name is Christine, and I am based in Birmingham, and I'm a trustee of SignHealth. I think I've been for about 4 years now, and I'm in my home currently. Over to you, Lucy. Lucy speaking. Hi, I'm Lucy, Director of Comms and Fundraising here at SignHealth. I joined back in September and I'm loving it so far, working and joining you here this morning from my office at home in the Midlands. And now over to you, Dr. Sarah Powell. Sarah speaking. Hi, good morning, everyone. I am Dr. Sarah Powell. I am a clinical psychologist and I work for SignHealth Psychological Therapies team. I'm currently working from home in my office and it's lovely to see you all. Deepa. Thank you for all introducing yourselves. We'll now start things going. I would just like to pass over to James. If you could just give us an overview of SignHealth and the services within SignHealth. So over to you. Thank you very much, Deepa, and thank you everybody for being here. We appreciate it. Thank you to Deepa for facilitating today and for the Cambridge Deaf Association for all their support with technology. One of the things I'm most proud of at SignHealth is how we work in partnership with lots of organisations, lots of other people, and today is a really good example of that. So thank you for your help, Andy. For those who don't know, SignHealth, we are the deaf health charity, and we've been around since 1986. So we have been going for some time, and some of you may know us for different things. Some of you may know us for our work in mental health. It's always been a really big part of what we do at SignHealth. We are now a health charity. We now focus on all aspects of deaf people's health, but mental health is a big part of what we do, and it's how we started. I think it's important to remember that we are a deaf organisation. So the majority of the people who work at SignHealth, including myself and my colleagues who are working on this event today, are deaf people, and the majority of our board are deaf too. That's a really important part for our organisation and our culture. So the most important part of today really is for us to listen to what deaf people want to say about deaf mental health. We know that there have been lots of conversations going on for a longer time, but particularly over the last few months, about deaf people's mental health and how people can get help and whether their problems are going to get help and how things compare to services compared to hearing people. And we want to try and answer some of those questions today. I'm sure we won't answer everybody's questions, but what we really want to do is listen to you and have you tell us, because that way we can be successful as an organisation and trying to represent all deaf people. We're really passionate about making sure our work is inclusive and that we are here for every deaf person in the country. So we want to hear from as many people and understand what you think. It's really important for us to reflect as well on the last few years and what's happened for people in the country, what's happened in the health service in this country, and things are quite difficult at the moment. COVID has had a really big impact. We know it had a big impact on the deaf community and on disabled people in general. We know that the majority of people who died in COVID were disabled people. And we know that from research that we did in COVID, that it had a really significant impact on deaf people's mental health during COVID. We know about the fantastic campaigning work that was done by Lynn Stewart-Taylor and many others on the Where is the Interpreter campaign. We know how let down we feel by the government and things that happened through COVID. But we're also proud in terms of what we did during COVID as a community. We did much work with Royal Association for the Deaf, and I'm proud of the work we did with Cambridge Deaf Association. And I think it was Deaf Plus who contacted us during COVID to work together on a video about vaccines and trying to encourage deaf people to get vaccines. And of course, we spent lots and lots of the charity's money on the BSL Health Access Service during the first part of COVID. So I'm really proud of what we did as a community and how we really stepped up to work together. One of the things I really want to do as an organisation is to continue to work together. We are here to improve deaf people's health and well-being. All deaf people's health and well-being. We will do that if we can work together, and this morning is a great example of that. I think it's also important to remember that there's a lot of pressure on the health system. You see the NHS in the headlines all the time. You see the pressure on hospitals and GPs. You see the nurses on strike. There are lots of cuts happening across parts of the NHS. Things are tough. So one of the things we try and do as an organisation is make sure that deaf people are not forgotten in those conversations. But we do have to remember that things are tough for everybody in the health system. We work really hard with NHS England, the organisation that manages and oversees the health system. But we know there have been lots of changes in the health system in the last year, massive changes, and lots of technical things about how the NHS runs. And we think that's going to make a big difference, hopefully to improve things over the next few years. We also know one of the biggest things that helps us is deaf people. When it comes to accessing health and social care services, one of the big achievements of the last 10 years is something called the Accessible Information Standard. And that is the guidelines, the legal requirements that means every time you go to see a doctor or any part of the health system, you should have access to an interpreter or whatever communication support you need. We're working with the health system to try and renew that standard, and we're expecting the NHS England to relaunch that in April. It's a really important part of how we access our rights. We'll be doing lots of work over the coming year to make sure that people know how to use it and how to get the best support they can in the healthcare system. There's lots going on, but most importantly, the thing for us to do as a deaf health charity is to make sure we know what you think, what you're worrying about, what you have questions about, and that's really the focus of this morning. So I don't want to say much more, just to say thank you again for being here, and we're looking forward to our conversations. At the start, I hope this is a continuing talk for the deaf community, more and more. But thanks for being here, and thank you, Deepa. Deepa speaking. Thank you, James. Thank you for explaining about the work that SignHealth has done up to now, up to date, and the issues going forward and what you will be focusing on. I would now like to hand over to Dr. Sarah Powell to give us an update about the psychological therapies. Thank you. Sarah speaking. I have run the psychological therapy service for 12 years.
However, recently, about a year ago, we got the NHS contract, which means that we were able to secure funding for therapy services, which is great news. Previous to that, if people wanted therapy services, they had to wait, they had to go through their GP, they had to wait for funding. There wasn't any funding in place for people. It wasn't consistent, which made it very difficult for deaf people. However, now we've managed to secure this funding from the NHS, means that people can come to us, we can assess whether they're suitable for our service, and if they are, we can get the funding for them. There are certain types of therapy that is not suitable for our service. You still need to get specific funding in place for that. However, we are expanding our psychological therapy service. We do have some new members of staff that are going through training, 3 trainees that started recently, and we have 2 more trainees that will be starting in March, which is a huge achievement and a great achievement that we've got more therapists, because the need for our service is growing. So we need to ensure that we have the staff to match that need. And having these trainees in place means that they can learn the specific strategies to deliver the therapy that is needed for deaf people, making sure that they have good practice, making sure that they do the right thing through therapy correctly. So there is specific training in place that they need to be able to work with sign language users, and that's an additional year of training. So once we can do that, we can then get more therapists on board. And we can get therapists that focus specifically on anxiety and depression, because those seem to be the main conditions that we're working with. A lot of anxiety, stress, fear, worries, embarrassment. So there is specific therapy that you can entail to help with those mental health conditions. We do cover the whole of England. We're proud to say that we cover the whole of England, which means that we have different therapists around the country, male, female, different gender, different ethnicity therapists. We do also have some clients that require an oral service, which we're able to provide. And we're also able to provide that service in British Sign Language as well. So it depends on the communication modes of the people that we work with. But yeah, up to now, we've been very successful with the work that we've done. Thank you very much, Sarah, for explaining about the psychological therapy service. So you've said that you've got therapists in place, hopefully, to match the needs of the deaf community. We're aware that you have a very long waiting list at the moment. So what are SignHealth trying to do to reduce the waiting list that you currently have? Okay, so I did briefly explain earlier that we will be having 5 new trainees on board. They have to follow, obviously, university requirements. We can't fast track them. They do need to go through the specialist training. We had 3 already start recently, and we've got 2 joining us next month. So they'll be going through intense training and learning about the specific therapy, and then they'll be able to start delivering therapy. And then hopefully once that cohort is done, we'll try and target more people to come through and to go through the training. That's one thing. The other thing that we are focusing on is anxiety workshops. So trying to deliver workshops to raise awareness about anxiety and the symptoms of anxiety, how you can self-identify whether you are suffering from anxiety. So these are different skills that we can deliver through the workshop. So we've already done a workshop. These workshops take place online, remotely. So we've done one which has been successful. There's also things that you can do online via webinars to learn about anxiety and how to deal with anxiety, how to deal with depression, and what strategies you can use to help maintain well-being, how you can have good sleep hygiene to help improve well-being. So it's something that you can do online in your own time. It's also got captions, and it's delivered in British Sign Language as well, so it is accessible. So those are different things that we're trying to do to reduce the waiting time on the waiting list. Obviously, there is a huge demand for the service, and we are trying to reduce the waiting time by delivering more training. Thank you for that, Sarah. It's useful to know that there's something in the meantime for people that need that support whilst they're waiting. So now moving on to you, Christine. No, sorry, not you, Christine. Sorry, we'll come back to you, James. The 2 Deaf Foot challenge that took place a few days ago, a lot of money was raised from the challenge that the two young deaf men did with that challenge. Can you explain what's happened to the funding that was raised and what the money has been spent on, please?
I think the first thing I want to say is thank you again to Mark and Daniel and all the amazing work that they did. Many of us will remember the walk that took weeks and weeks from Scotland all the way to Cornwall, and just how hard everybody worked to raise money and to work together as a community. I'm really proud of what they achieved. It's a really significant achievement, and I think we'll all remember it forever. The main thing I want to say is that we haven't spent the money. The money is still in our bank account. And because we're a charity and we publish our accounts every year on the Charity Commission website and our own website, you can see it sitting in our accounts and we haven't touched it. And the reason we haven't touched it is because we want to make sure that we're spending it on absolutely the best thing. Have to be honest, and our plans to spend that money were completely diverted because of COVID. So we spent the last 2 or 3 years, like everybody else, very focused on trying to respond to COVID. But now that we're coming out of COVID, now's the right time for us to really work hard on thinking the best way to use that money. We want to make sure that the money that was raised by all of those people up and down the country supporting Mark and Daniel, we want to make sure that money is used in the best possible way to support deaf people's mental health, and that's what we're determined to do. So our board of trustees, including Christine, agreed to hold that money very specially separately, so it can't be spent on anything else within the charity. So when we make those decisions during this year, we'll update everybody and let everybody know what we're doing. But the main thing to say is thank you to Mark and Daniel and everybody else who raised all the money.
Thank you, James. It's good to know that the money will be going directly to frontline services within the community, which is what deaf people need. I'd now like to move over to you, Christine. In terms of mental health services for deaf people, how has it changed over the years? What is it like now for the deaf community compared to what it was like in the past?
Thank you, Deepa. I've worked in the mental health sector for it's been a long time, maybe over 30 years. And when you first asked me that question, I really had to think about it. I had to look back over that period and just sort of analyse how much has really changed since then. I think it was 1980. I sort of started in that time. I was working out in the community, mainly in Warsaw. And there were so many people I remember at the time that struggled with the awareness of mental health and the topic. So within the deaf community, there wasn't much awareness of mental health. There was a lot of barriers and lack of access to information, especially information into BSL about mental health. So I think sometimes it's quite difficult. I think there was a fear around the topic of mental health. People who had mental health, it would be seen as something to be feared about. We don't want them in the deaf community. We didn't know how to support them, how to talk to them. That was what it was like at that time. Nobody talked about mental health openly. It was kept, and it was not talked about. So I think at the time it was difficult, but there has been such a big change from then up until now. And I think there's so much more information. People are more open to talking about it. There's so much on social media, that on Facebook, for example, Twitter, so much more access to information. And I think deaf people in the deaf community are more able to self-reflect, be more open about how they are feeling, and then ask for that support. And there's a lot more demand because of that. I think people know there are services out there. They know that they need and want support, and they're able to access, so they're able to self-identify what they're feeling, what's happening to me, why is this happening, and then take that step to making the change and improving things. And I think the communication has been a massive change as well. I think before face-to-face services were all that was available. At the time, the support that deaf people were receiving were from social workers of the deaf in the community, and that was all. There was really not much mental health services, especially for deaf people. I know there was one psychiatry hospital that was up in Preston at the time. That was the only one. So if deaf people needed help, specific mental health services, if they were in crisis, for example, there was a long waiting list, 6 months even, before they could access support, or they would have to drive with their parents, with social workers, all the way over to Preston, and from all over England to access that service. So it was rare to have that community support, that local support. So it's a really difficult time back then, and we knew that things had to change. And I think we tried to improve things through workshops, through training, explaining how to access services that were that far. And then obviously services have improved since then. And I think there have been more psychological therapy services, mental health services within the NHS that have grown. You can access services in hospital now as well, but I think the support in the community also, things now are much better within that community. There's much more support, many more services. And I think especially from SignHealth, that's helped to contribute to how many more services, as well as other organisations. So I think it's really good to see things improving. The number of social workers of the deaf are decreasing, and I think they need a variety of support, not just those social workers. So through different assessments of support, you can identify exactly what somebody needs. And it's brilliant that you can get different support from not just services, but friends, through talking therapy, psychological therapies as well. So it's really good to see such a range of diversity and support and access, and so much more information through Facebook, Twitter, social media, television. You can see things in the theatre talking about mental health in their productions. So many things now that really help. And I was a social worker within a hospital, so myself, I saw, and this was a long time ago, when assessments were being done for diagnosis. Really, it wasn't a detailed and in-depth assessment, because of the communication. It was limited, but so much of that has also improved and enabled those in-depth assessments to take place to accurately diagnose somebody and then offer the appropriate support. So definitely, over time, things have changed, and that's to do with the communication. Back then, there was a lot of communication breakdown. Deaf people were deprived of appropriate support because of a lack of diagnosis. So when people feel that improvement, start to feel better, they can then be discharged from hospital and go home, but they would need extra support when they're back out into the community. And sometimes it wasn't brilliant. So in Birmingham, Manchester, London, the cities, they sometimes had mental health deaf services, but in other areas that were more rural and more remote, there wasn't much out there in terms of support. But now, definitely, you can access support online, which is much better. So things are definitely improving, and that's great to see that improvement. But I think it's just the waiting list for going into hospital, the waiting list for discharge from hospital, also the waiting list for assessment for support workers or support in the home. I think not much has changed there. So yeah, I think now, again, like I said, over time, maybe the 10 years, I think that's where the most difficulty has been. And I think in services, things are struggling because of maybe cuts, and that does cause difficulties. But I think things have been improving. And I think, as an example, coronavirus, We had what was it called? The access to the NHS, to GPs. SignHealth, I think, really supported and contributed to that access, and supported the government in having deaf people access those health services. But some services have had to stop. So things like that, I think we really need to think about. Brilliant, there are things that are improving since 30 years ago, but there are still things that we're behind on. There are lots of gaps in services still. And I do know that SignHealth have a lot of ideas. They have so many plans for what they want to do in the future, similar to what James was saying. You know, and we just need to work out which right now are a priority. How do we fill those current gaps? Which services need support? And really what we need to do is all work together. I think it's really important as well to find exactly what the deaf community need and want, and then identify how we can work together in partnership to achieve that and help those services.
Thank you, Christine. That's really useful to know what it was like 30 years ago compared to what it's like now, in terms of how awareness has improved and how access to services have improved. But on the other hand, there are still difficulties that we're facing in terms of cuts and waiting lists. So that's really useful. Thank you. Just asking you all now, please put your comments if you know what changes need to be made and what changes you think would be good. We'll now like to hand over to you, Lucy. This coming week will be Children's Mental Health Week. Just wondering what SignHealth are doing to promote that week.
Okay, so yes, Monday the 6th of February is the start of Children's Mental Health Week. And that is when SignHealth will be launching a new webpage on our website. And that will be specifically to do with children and young people's mental health. I think really this is a really good stepping stone in starting to grow our work with children and young people. We have so much to do, and we really want to do more, but we really want to specifically campaign, raise more awareness, and engage with other organisations, the NHS and the government as well, other deaf organisations as well, to do more.
That's really good to know, Lucy, what you'll be doing, and also the work that you'll be doing to focus on children and their mental health. We now have a question from the audience. This is a question for you, James. The question is, what's happening with Deaf for Deaf? Could you explain a little bit about that?
Sure. There's not a lot to say, and Deaf for Deaf is another organisation working in deaf mental health, and we work with them from time to time, and we know them well, and we see them at events for mental health that we attend. And as I said at the start, we need to work with everybody we possibly can to achieve the purpose we have to improve deaf people's health and well-being. So we know and respect that Deaf for Deaf do their work and we do our work. So that it's important that as many organisations as possible are supporting deaf people's mental health. So we'll continue to work with them.
We now have another question for you, James, so we'll stick with you for now. How many trustees on the board are experts through experience?
So experts by experience is a kind of technical term that gets used quite a lot in the health system and other public sector systems. And most of the time it means it's trying to respect the lived experience of people who have been through a situation that is similar to the work that's being done by that organisation. So it can be used in quite a technical way. We have 8 trustees on the SignHealth board at the moment, and 5 of those 8 trustees are deaf people. Many of our trustees have had mental health difficulties and have lived experience of navigating the mental health system and, of course, the health system too. One of the advantages for us in being a deaf-led organisation is that we have a really good appreciation of deaf culture at every level of the organisation. So, for example, our chair, Jackie Driver, is a deaf woman who works in the health system and has personal experience of the health system, both as a patient herself, but also as a carer for her own family. So I think all of us, including our board, bring a real variety of lived experience to the work that we do. I think we can do more, though. I think we want to make sure that we are connected as possible to as many deaf people as possible. We know that there is a real diversity of experience and that my experience will be different to yours. So the more experience we have access to, the better. The more connected we are to people's stories, the better.
So if you have a particular example of problems with the health system or good things that you want to celebrate, maybe, please do let us know about your experience of navigating the health system. We have been recruiting trustees recently to join our board and are really excited by the people who have applied to join us as trustees. We're now going through that interview process at the moment, and we're hoping to welcome more deaf people with more lived experience onto our board very soon. So thank you, James. It's really important that we have that lived experience. So got another question now, and this is for Lucy. So you're the head of comms and fundraising. Could you let us know how SignHealth have been spending the finances?
Yes, so SignHealth have got a range of different things that we are spending the money that we raise on. So, for example, psychological therapy services as one, social care services as another, and that includes outreach work. I think we have 5 different homes around the UK, so we're providing services through those. We also have a domestic abuse service, and that service includes adult and young people. So that's one area that we are devoting a lot of our money to. Also, like I mentioned earlier, we are establishing children and young people's work within SignHealth, and we'll be growing that work. And finally, we are looking to start a campaign because we feel that it's really important to have social change, and the only way to change is through campaigning. So that will involve work with the deaf community, deaf organisations as well. And they are all really good examples of what we are doing with money at the moment.
Thank you, Lucy. We have another question from the audience. This question's for you, Sarah. Do you think mainstream services have more awareness about deaf people and their mental health? That's the first part of the question. And the second part of the question is, what steps are SignHealth taking in terms of mainstream services, and what mainstream services can do to improve their services? The therapists and the clinical practitioners that are provided, what action do they actually need to take to be able to support the deaf community? It's a very good question. Okay, so first of all, we need to think about why deaf people do go to mainstream services. Sometimes they don't meet the criteria that we have in place, so they do need to access a mainstream service via an interpreter. Other reasons are that they don't actually want to use our service. They would just like to access a mainstream service. It's important that we think about choice and people's choice. Mainstream services do also have a waiting list, just like we have a waiting list. So it's difficult for the deaf community to access mainstream services. Unfortunately, a lot of mainstream services don't know how to engage with the deaf community, or some services are not accessible, whether they're phone services or information resources, leaflets, etc. are not accessible because they're in written English. Also, sometimes deaf people will go to a mainstream service and there's no interpreter booked for that appointment, and they try to communicate through written English. There's also the other added problem of, even if you do get an appointment and you have an interpreter, you might not have the same interpreter for all of your sessions, so there's no interpreter continuity there. Or the interpreter could come up and you might know the interpreter and there'd be a clash of conflict there, so you need to wait for a different interpreter to be sourced. So that's the feedback that is coming back from the deaf community about those people that are accessing mainstream services and the barriers that they are facing. If mainstream services want to make their services more deaf friendly, then they need to have annual deaf awareness training. That deaf awareness training can't be delivered one-off. It has to be delivered annually, and it has to be mandatory training. At the moment, there's nothing like that in place, but that would help to relieve some of the pressures and the barriers, and also to be aware about the accessible information standards, like James explained earlier, which means that, you know, deaf people have the right to access information through different means, whether that's email, text message, VRS. And it's important that they know how to book an interpreter, how to source an interpreter, and how to try and get the same interpreter for the appointments, and which interpreters they can access to try and get interpreters quickly. They also need to be able to engage with organisations such as ourselves so that they can have the best practice in place when they are working with the deaf community. But that's not enough. They also need to speak to the deaf community and the deaf people that they encounter just to see what needs they have. They can't assume that everybody uses British Sign Language or everybody uses oral communication. They do need to meet deaf people and assess what communication modes they use. And they also need to assess the deaf person to see the level of language that they have and whether they can receive information that is heavily jargoned or not, whether they need simplified information. But they need to adapt their communication modes to the deaf people that they're meeting. And like I said, they need to have deaf awareness, they need to be aware of accessible information standards, and work with organisations such as ourselves and adapt their services to match the needs of the deaf community. So not using the telephone, trying to use text messages and emails and different services. So, I mean, it's all right saying all of that, but yeah, more does need to be done. Thank you, Sarah. That's really useful. We do have some more questions coming through from the audience. The next question is for you, James. The Shout text messaging service, what's happening with that? And does SignHealth actually manage that service? A lot of people have a different experience when using the Shout service. So how can you improve the deaf person's experience?
Thanks, Deepa. So we don't run the Shout service. We work with the organisation that runs it. And if you don't know, Shout is a crisis mental health text service. So you can get help by texting the word deaf to 85258. And their service is available 24 hours a day, 7 days a week, and it is staffed by volunteers. So when you send a text to that service, a trained volunteer will answer you and try to help you get help. So it's not a counselling service. It's if you're in a real mental health crisis and you need help as quickly as possible, perhaps to get to some more help, to get an ambulance or to get to an A&E or to get to somebody who you trust. We know that the most important thing you can do to support your mental health is to talk to somebody. So the Shout service is really trying to help you do that. As I said, the service is staffed by volunteers. We don't manage those volunteers. Shout manages the volunteers themselves. And they aim to answer the text messages as quickly as they can. But I know that it doesn't always happen as quickly as people would like. I know that there have also been some times when people have seen a message saying they're being charged for the service. And it's helpful, I hope, for me to clarify, you won't ever be charged for using Shout. So sometimes you get that message in error, but it is an error, it's not real, you won't be charged for using Shout. So please do bear that in mind. But if you do need help and you're not getting a response from Shout, then I'd really encourage you, and if you are in an emergency situation, then I would encourage you to use 999. And of course, there is now BSL access to 999 services.
Thank you, James. So yes, don't worry, Shout is a free service, so please don't worry that you'll be charged for using that service. The next question is for you, Lucy. It's a question about the website. Someone has asked if the website can be updated in terms of stories from deaf and the hard of hearing community, and if there could be more diversity within those stories on the website.
Absolutely. Thank you to the person who made that comment. I think it's really important that we take on that feedback from the community, and that's the only way that we will be able to improve. I completely agree. It's so important to have diversity on our website or in any of our materials. And I think I'd be really interested to know if we could create new stories and have like a story web page, which we could update with new stories. And that could be an ongoing project that we continue to update. So definitely I would have a look on our website, and I would hope to see some new stories.
Thank you, Lucy. Yeah, it's really important to have diversity and to show that on the website. Mental health doesn't affect one specific community, it affects everybody. Okay. The next question is SignHealth will be reaching, when SignHealth reaches a key milestone such as 30-year celebration or 40-year celebration, will SignHealth be organising a big celebration event in London?
Oh, that's a nice idea. I think the most important thing, though, is when we are celebrating, it's really making sure that we're celebrating the community. It's not about us as SignHealth. So I think, yes, we haven't really started thinking about anything, but I would like to hear your ideas and feedback. They're always welcome. So let me know what you think we should do.
Thank you, Lucy. Okay, this is a question based around what SignHealth are trying to do to engage with deaf communities around the country, such as Derby, Manchester, Nottingham.
Okay, so we have just employed a new community engagement officer, and that person will be working with the deaf communities face-to-face, visiting different areas. And the thing that we are really aiming to do this year is to try and find and access hard-to-reach groups. So SignHealth, we are very aware here that not everybody can access things online. Some people can't access the internet or aren't technology advanced. So I think that face-to-face work is really important to us.
Thank you. We have another question from the audience. I think this is aimed at you, Sarah. You might have already answered this, but it would be good to recap if you have. Just want to know from you, if a deaf person needs counselling, what do they do in the first instance, and what is the process of going through that and setting up sessions with a counsellor? Do they need to contact their GP, or do they come directly to SignHealth? That's a really good question. It's really good for the person to be able to self-identify that they do need help and they do need to do something to look after themselves. So on our website, there is a section there. If you would like to self-refer, you can complete an online form, and then somebody will text you from the service to find the best suitable time for you to have a remote conversation or a text message conversation. That usually takes place within the first 6 weeks, and that follows the NHS guidelines, is that if somebody does make contact, you should contact them within the first 6 weeks to give them their initial appointment. Obviously, we know the deaf community is extremely small, but in that first appointment, we'll try to source somebody that doesn't know the person and matches the same communication modes as themselves and is the right gender that they would prefer for that therapist to be. In that initial appointment, it will be to work out what the best plan of action is for that person and whether our service is the most suitable service for them. If we don't feel that we are the right service, we will make sure that we signpost them to a more suitable service. After that, they will then be put onto the waiting list. There are different waiting lists depending on the different service that they might require. So we have CBT, which is cognitive behavioural therapy, and we also have a few different therapists that can offer different sessions. So if you can do things yourself and you can access that support online, then you can go to the GP and the GP can refer you on to us, or you can get a referral from a different professional, from a teacher. It has to be from someone that you know and someone that you agree to for that referral. So you can either self-refer or have a referral through a professional. Thank you, Sarah. This is just a message for the audience. We've only got 15 minutes left, so keep your questions and comments coming and we'll try our best to answer them. This is another question for you, Sarah. If someone needs immediate support and they need that immediately, is there a system in place at SignHealth for that immediate support? Is there something there that deaf people can access in their communication mode immediately? I think it's really important to remember that at SignHealth, we are not a crisis service. We focus on therapy for depression and anxiety. That is our aim. There are other organisations and other services out there that provide a crisis service. I know that they're not entirely accessible for the deaf community, but we are not a crisis service. We do wellbeing checks monthly for those people that are on our waiting list. We do check in with them. And if their symptoms start to get worse, then they possibly would have to access a different service, possibly a crisis service, or access their GP and explain how they are feeling and the situation they are facing. There might be additional support for them locally via the GP, but unfortunately we don't cover a crisis service. So it is important to remember that, just like the NHS have doctors, hospitals, walk-in centres, A&E, different levels of requirement, it's the same for us, and we don't have a crisis service. And unfortunately, if you are in crisis, we can't move you up on the waiting list. We can move you up on the waiting list if you are pregnant or if you have a child under the age of 1, as per the NHS guidelines, because it's very important to look after people that are pregnant and have children under the age of 1. But if you are experiencing symptoms and you are coming up to crisis, then it's important that you go to your GP and access a crisis service. There are some areas that have a VRS service in place and some areas that have a text message SMS service in place. However, a lot of those services are via the telephone. So the best thing to do is to go to your GP. Yeah. Thank you for that, Sarah. It's important to know that there is the waiting list and what people can do in that situation. Sticking with you, Sarah, another question. If somebody wants to start the... Sorry, just going to go back slightly. The interpreter missed the question. Sorry, just going to repeat that question for the interpreter. This is a question from the audience. So there might be deaf people in the community or hard of health people that have a certificate in mental health first aid. They might be skilled in that area. How can they use that qualification that they have to support SignHealth? I think the best thing for those people would be for them to inform their local organisations that they have a mental health first aid certificate. There might be a drop-in service at their local organisation, or there might be wellbeing groups. SignHealth Psychological Therapy Service, we only use trained therapists that have been through university and have the qualifications to deliver that service. That's what we currently have in the psychological therapy service. But it would be really good for those people to contact other organisations to see what they can do. Maybe they can set up a drop-in service or a wellbeing group, or set up conversations with their friends so that people are talking more, and just put those, spread the word out amongst the community that they have those qualifications, because that would really help so that people know they have a point of contact and somebody they can go to. Yes, you're right there, Sarah. You know, maybe they can offer that additional support before things get too much. Okay, so the next question we have is possibly for James or Lucy. Does SignHealth have any voluntary or apprenticeship facilities within the organisation? Is there anything they're doing about that?
Okay, so we do have some opportunities for volunteering. An example of one would be through our board of trustees. And then also we have a shadow trustees scheme that we will be launching soon. That is really good for people who don't feel quite ready to become a full trustee yet, or they are from a background which means they don't have many opportunities like that, which means they will be able to join through the shadow trustee scheme. And now we are trying to recruit more people to be in our advisory board group. And that specifically is part of our campaign. So we want to set up an advisory group. So if you look on our website, and there's a lot more information there about that advisory group, and please do join. Everybody's very, very welcome.
James, is there anything you'd like to add?
I think Lucy's covered the big opportunities that are there, but I just want to pick up on something that Sarah mentioned in her previous answer, if I may. I think Sarah's talking about a really big gap. You know, there isn't an accessible crisis service for deaf people. I think it's really important we're open about that. It doesn't exist. So we are disappointed that we don't have one to offer. We would love to do that. And it is something we talk to the NHS about. But there are lots of gaps in the system, and that is one of them. So I want to be honest and open with the audience today and be clear. Sarah's been very clear about what our service is and what it isn't. I think that's really important. But we know that means that there isn't everything that deaf people need. So we need more ideas about what else is missing. We need to keep trying to put pressure on the NHS to develop the right services and make sure they are accessible. And that's what we try and do every day. But we're not there yet. There's more to do.
Thank you, James. Just to follow up on that point, this is a question now to everybody that's watching, to the deaf community and the hard of hearing community. Is there anything that you feel the NHS need to work on now? Is there something that they can do to improve their services immediately? Please let us know your thoughts and your comments via email or through social media. And like Sarah and James have already mentioned, in terms of a crisis service, that's one example of something that is needed imminently. But please send us in your thoughts and comments. You might not want to do that today. You might want to do that at a later date, but please send in your thoughts and your comments, and SignHealth will collate all your comments. We just have a few minutes left because we will be finishing at 11:30. So are there any closing comments from anyone on the panel? Oh, sorry, from Lucy.
Yes, I would like to ask people just to have a think, because this is not a one-off conversation. We want to continue this conversation with all of the deaf community. So I'd be really interested to know if you wanted something like this again, a live streamed webinar. Do you think that this was useful this morning? Please do feedback. We want to hear your views, and let us know also what you want more from SignHealth. And also, I would just say, don't forget to send your thoughts in about what we can do to improve and make a real difference. So yeah, please let us know. Are there any other thoughts, comments?
Yes. Any other final comments from anybody else on the panel? Christine, James, Sarah? Christine, do you have a closing comment? Okay, I'd just like to say thank you to everyone in the audience for sending us in your questions and your comments today. They're really appreciated, and SignHealth are very grateful for your interaction today. We, SignHealth, want to know what you need, and hopefully they can try and make these changes for you. So please keep sending in your questions and your comments. So this live stream will be taken off Facebook and will be uploaded to the SignHealth website. So for those who missed it today, they can log in and watch it at another time. So thank you very much for all your comments and questions and your interaction today. I'd just like to say thank you very much to the interpreters, the STTR that we've had on board today. And thank you very much to the panel for explaining what SignHealth have been doing today. And we're really optimistic about the future and really looking forward to the future. I hope you all have a lovely weekend, and thank you very much. Bye-bye, everyone.